Hello, everyone. It's Monday, April the 5th. I hope and pray everyone had a happy Easter, and I know that there's surely some families and some folks that it was a tough time of year, but a very, very, very blessed time of year. So, you know, we have had 8 additional deaths since Friday, which still is trending exactly really good, and but at the same time, there are 8 more great West Virginians that we've lost, and 2 or 3 that are very, very, very young in my eyes, that's for sure. But our 2,689th death is a 63-year-old male from Fayette County. Our 2,690th death, a 74-year-old male from Taylor County. Our 2,691st death is a 45-year-old female from Logan County. Our 2,692nd death is an 88-year-old male from Kanawha County. Our 2,693rd death is an 89-year-old male from Brooke County. Our 2,694th death is a 77-year-old male from Ohio County. Our 2,695th death is a 50-year-old male from Wetzel County. And our 2,696th death in West Virginia is a 42-year-old female from Fayette County. And you just think, of these 8 individuals, 142, 145, 150, then it jumps up to 63. I'm telling you, I just got a text just a few minutes ago from Dr. Marsh. And Dr. Marsh is confirming in many ways that the variant, and I'm sure it is the UK variant coming from England, but that variant is really, really attacking our younger folks. And so we need to watch, and we need to be concerned, as we always are, and our experts need to be absolutely on top of this in every way, as I know they are. But as that, comes about, this is just the beginning of a shot across your bow. If you happen to be a younger person, you really need to know that you need to be vaccinated. If in fact this variant, and Dr. Marsh will talk more about that in just a few moments, but if in fact this variant is attacking the younger folks, as the COVID-19 did to our older folks, then you've got to get vaccinated. That's just all there is to it. Because, so many side effects and things can happen here, but without any question whatsoever, you've got to get vaccinated. That's all there is to it. And Dr. Marsh will be talking more about that. Over the weekend, we had 77 new positive cases in the last 24 hours. Our daily positivity rate jumped up to 6.53, but we probably just didn't test many folks. Our cumulative rate still continues to fall a little bit. We're at 5.25. Our active cases are 6,955. We were at a time when we were right at 5,000 or maybe a little below. I can't recall exactly what that was, but now we're up closer to 7,000 of active cases. We have recovered cases of 134,082. We have hospitalized 259 people in West Virginia, and in the ICU units, 80 people. We have 2 counties in the red. Still Berkeley and Raleigh County are in the red. We've got to do better there. But the bottom line to the whole thing is we've got more people in the ICU. We've got more people in the hospital. We've got more active cases. This thing is not going away without a last push on its side, but we can make it go away. We can make it go away with the vaccination. So please, 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 younger folks, you got to listen to me again. We got to get vaccinated. A reminder to our older folks, because this thing is a super killer to our older folks, 65 and older. If you get any kind of symptoms at all, go get tested. It's not going to hurt. It's free as it can be. And if we can catch these early enough, we're going to get you these antibodies, and it'll make you well. You know, our vaccine eligibility is all folks in West Virginia age 16 and above. I highly encourage absolutely people to take this shot and get vaccinated, and we're going to continue to prioritize those folks that are older, 65 and older, and we're going to just continue to get shots in arms as fast as we possibly can. We're at 94.8% total administration of the first and second doses right now. Our goal is always 100%. We have officially reached a new milestone in West Virginia where we've gone over 500,000 West Virginians have now been given at least one dose. To date, in West Virginia has administered 528,119 first doses, and we have administered 353,473 second doses, and we have put in arms of people, first and second doses together, 881,592 doses in West Virginia. But we still only have really 528,000 of 1,700,000 and some thousand. We still have less than a third of our total population. We've got to move that up. So younger folks, please listen to me. We need you to get your shots and everything. And absolutely, it could very well save your life. You know, on our Saving Our Wisdom clinics and everything, this number is absolutely always a fabulous number to report, because we had so many elderly that were sitting wondering, well, what's going to happen to me with this thing running rampant in January, and it was looking terrible. We moved, and we got people moved right up to the front of the lines and everything, and 241,326 individuals that are 65 and older have gotten your first shot. That's out of a population of only around 350,000 or 360. So with that, that's 72+% of our 65 and older have been vaccinated. Now, I want us to get to 85%, and I'm going to keep pushing like crazy until we get there, or higher. And if you're 65 and older and still waiting on a vaccine, please go online here and call these numbers. Call our numbers that are up there right now, and we'll get you that vaccine. As far as our manufacturing outreach, you know, our joint interagency task force continues to reach out to our manufacturers and businesses across the state to increase the number of spots that we can go and set up a clinic at your business, wherever it may be, at your church, wherever it may be, and get either your congregation or the workers there at your manufacturing spot or whatever business it may be vaccinated. You know, so if you have a facility and you want to host a clinic, please just call our numbers again. John and Jordan, put them back up one more time. Please call us and we'll come and set that clinic up. You know, as General Hoyer said on Monday, we also want to offer vaccine clinics to all of our churches as well. If you're a church pastor and you have a congregation that hasn't had the opportunity to get vaccinated, contact our info line and we'll work with you to set up a vaccine clinic at your church. The vaccine info line is up. The reminders about vaccines is, for crying out loud, quit believing and listening to this myth that people promote and everything. Misery always loves company, you know, and so somebody that's decided not to take their shot, all they want's company, all they want's others around them that haven't taken their shot and everything. Don't listen to this stuff. Don't listen to it. Just get your shots, because this will save your life. All of our free testing is still available, and take advantage of it in every way. Again, thank you to Frith and Walgreens for all their drive-through pharmacy work and all the work that they've done and continue to do. They've done great work. Our long-term care facilities, we were down to 1, I think. Now we have 8 outbreaks in our long-term care facilities. We have 7 outbreaks in our churches in 6 counties. That's Fayette, Grant, Harrison, Kanawha, Nicholas, and Raleigh counties where we got church outbreaks. Our corrections update, we've popped up again. We're at 52 inmate cases and 10 staff cases, and there's 21 at the Salem Correctional Center, 16 at South Central Regional, and 13 at Southern Regional. That just jumps up and down. We run to the fire all the time. You've got to commend the corrections folks because they've done incredible work. Now, our guidelines should all be up there. You should always remember to wear your face covering, out in public. I know we don't like to do this. I don't like to do it either, but absolutely it is saving lives, and it could save your life as well. This will end. This mask right here will end. It will end for every last one of us, but the problem with the whole thing is just this. If we don't wear these masks right now, somebody's going to die. May very well be you, but additional people will die. We know it for sure. There is no question whatsoever, if we don't wear these masks, more people are going to die, and it may be you. So we got to do it for a little bit longer. How much of an inconvenience could that possibly be? I mean, to sit back and say, that's my right. Well, it may be your right to walk off the cliff, but it's not your right to absolutely pull somebody off the cliff with you. And so we got to do that for a little while. We got to think about giving blood in every way. It's really important. And if you've survived this, you ought to really think about it, because you have had a blessing bestowed upon you from God above, and literally you should think really hard about going and giving blood, because you could very well save a life. Now, I've got two other announcements here. One I was really, really close to. Upper Big Branch. It happened 11 years ago. It seems like it just happened. There was all kinds of speculation running around in a lot of different directions as to what happened. In my world, it's just a crying shame. On April 5th, 2010, an explosion at the Upper Big Branch mine killed 29 great West Virginians. It's hard to believe, really, it was 11 years ago. Kathy and I have said lots and lots of prayers for all those that were involved in every way. The families of the great people we lost, and it won't ever go away. But absolutely, we know the contribution that these great miners and absolutely all of our miners bring to us all the time. We should continue in every effort to try to be as safe as we possibly can. It is a dangerous profession. And absolutely, I believe with all in me that I just can't fathom that anyone purposely tried to do something that knowingly was going to lead to some horrible disaster like this. Nevertheless, bad things, really bad things can happen. And I can say that through all that, but whether management, or whatever it may be, we all have to strive to continue to do better in every way. Whether you're a worker there or you're the management there, well, whatever it may be in this industry, all need to try with all in them to do better. There is no ton of coal that will ever be worth just what happened here. Never, never. And so with all that, as Kathy and I do, we continue to pray for all these great people, and especially the 29 that we lost and their families. Good people. Good West Virginians. Now, I've got one other thing, and this is about a gentleman that gave so much. His name, Ronald Lee Jones Jr. He was the executive director of the West Virginia Human Rights Commission, 48 years old. Played football for Virginia Tech and West Virginia Tech, was a coach at Chapmanville Middle School, coached at Chapmansville High School. He did so much it was unknown. I mean, it was just unknown, all the great stuff that he did. In fact, I've got that completely backwards. Please forgive me. He was known for all the incredible things that he did. So many things that he did that were unknown or unnoticed were absolutely numerous in this man's life. Around Charleston, he was known as Ron. Down in the Logan area, he was probably known as Lee. You know, what a loss. The loss that he is survived by his teenage son. What an incredible loss to the community and to this state. 48 years old. 48 years old. What a great man. I hope and pray that all of you will remember him today and in the days to come, and all those that loved him. You know, my chief of staff is from Logan, and he just spoke that he played football with him. And I think Ron was a couple of years older than him in school, but he played football with him. And he talked about what a great man that we've lost in West Virginia. So with all that and everything, remember him, please. And I don't really have anything else. Thank y'all.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. I want to follow up with what the governor introduced, and I did send him a text this morning just telling him about my concern for what we see starting to unfold across our country. And as we look, we talked last week about the state of Michigan that was seeing a very high number of the United Kingdom variant viruses that were circulating in Michigan. And that is correlated now with them having the second highest number, I believe, to Florida, of these variant viruses that are found in their population. And as we've talked about previously, the United Kingdom variant, which many experts predict will be the dominant variant, if not in some states already is, but will be in the next few weeks. And every week this variant is doubling in most of our states. We are also seeing an increased number of the United Kingdom variants. Now we are over 100, and also some of the California variant, which is a less deadly, but still more infectious variant of COVID-19. And I'll talk about the United Kingdom variant in brief one more time, but I think that the message that I want to send today is that we have done really well as a state. West Virginia has led the way, and we've talked about that, and we're very proud and incredibly grateful for each person's part in that, because it takes a village here. It takes all of us, not just some of us. And we can make recommendations, but if people don't follow those recommendations, it does make the state much higher risk for all of us. And we're seeing the virus now starting to mutate. There's a new variant in India that shares some of the characteristics with the South African variant and the Brazilian variant, and it just showed up in California and San Francisco area. So we know that the variants will continue to be produced, and the real question of whether those variants take hold and become really dangerous to all of us is really up to all of us. We know that the United Kingdom variant is particularly of concern, not only because it is multiplying rapidly across the world, And we in West Virginia do have the benefit of oftentimes we're a little bit behind the rest of our country. So we do have an opportunity to anticipate what's going to happen and then try to do the things that the governor has done consistently. And we have certainly supported, in the ability to try to protect West Virginians. And the key, again, is to wear your mask and stay physically distanced and wash your hands. But today, the important other thing that is really critically important, crucially important, is that every West Virginian, we hope, who has that opportunity to be vaccinated will choose to do so. The vaccines are very effective against these variants. And the vaccine manufacturers are anticipating the potential that even more variants may come up, and they're starting to create new vaccines that will be able to help us if indeed at some point some of the variants elude the ability for people who have natively had COVID-19 to fight it off, the so-called breakthrough infections, or even if people who have been immunized before get reinfected. And we want to make sure that we are sufficiently protecting each West Virginian. So as we've said before, the time is now. It is this opportunity for us to be a beacon to stop the spread of COVID-19 as it currently exists in West Virginia by choosing to be vaccinated. And until you are vaccinated, please wear your masks and stay physically distanced. This UK variant is making children sick, is making young adults sick, is making 30 to 40-year-olds sick, putting people in the hospital. It's different. One of the experts, Tony Fauci, and another expert, Michael Osterholm, over the weekend said that we should consider this variant like a new COVID-19 virus because of its tendency to hit people that are younger and not people that are older. And we still have to remember that we have treatments, and we want to use the treatments in people that are high risk medically at ages over 12 years old, and those criteria are posted, and we're happy to refer you to the DHHR website to get those. But the key, an ounce of prevention is worth a pound of cure. So West Virginia, it's our time to continue to shine, to do the appropriate mitigation strategies, and please, please, please choose to be vaccinated. That is the way that we protect ourselves, protect each other, slow the spread of COVID-19 in West Virginia, and eventually stop the spread of COVID-19 in West Virginia, even the variants. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. As you heard the governor talk about, and from the data Dr. Marsh presented, Governor's pushed a new sense of urgency onto our interagency task force. And while we continue to push out PPE to our counties in a new initiative there, we continue to work testing and continue to work with our hospitals and others to make sure that we have enough of antibodies and other treatments. Our top three priorities continue to be vaccinate, vaccinate, vaccinate. As the governor pointed out, we are working aggressively with retailers, manufacturers, churches, and others to ensure that we build additional capacity to get into communities and get as many people as possible vaccinated. Last week, we started with 4 counties in vaccinating our 16 to 18-year-olds in our school systems. This week, there are 12 counties, and next week after spring break, another 14 counties, and we'll continue to press to get to working with the State Department of Education and our county boards to get to our 16 to 18-year-olds in schools. We also need to know that we need to open up more efforts with those retailers, manufacturers, and others to get those populations in the age 18 to 50 who are now being impacted so dramatically by the variants. So we will continue to work that and continue to refine our data. We're doing a lot of work this week with the CDC through DHHR and other data teams at WVU to refine our data to make sure that we have the best picture of where we are across the state. So a lot of work going on this week, continuing to press to make sure that we get to vaccinate as many as possible. Thank you.
Thank you, sir. Dr. Inamjad, our State Health Officer, and Secretary Bill Crouch from the DHHR are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thank you for taking the question. This could be answered by Governor Justice. He may want to weigh in on it, but it's really more for Dr. Marsh. Doctor, if you could talk from a medical standpoint of what's going on in Texas. I know we've used the Michigan example for the UK variant, but in Texas, what we've seen a mask order rescinded, everything open, and their cases, as their governor pointed out last week, have dropped precipitously. So that makes me, not being a medical professional, makes me wonder, is there more than one correct path as we move forward? We've seen some states that have very stringent standards in place, masks still in use, still not outdoor dining, it's indoor dining, et cetera, et cetera. Their cases are way up. We see other states like Texas, which is wide open, no masks, their cases are way down. So is there a medical explanation for any of this? And is it possible that masks and things like that could be loosened more quickly than perhaps some states like West Virginia have elected to do? Thank you.
Kenny, let me jump in and start. You know, for all practical purposes, other than the mask, you know, we're about as open as you can get other than the mask. But Dr. Marsh, you're going to have to take it from there, and you know, I mean, Kenny, there's nothing on the planet I'd rather get rid of, you know, tomorrow than these masks. But I'm absolutely always going to listen first and foremost to the medical team and the experts. But Dr. Marsh, if you could take over, please.
Well, thank you, Governor, and thank you, Kenny, for that question. And Kenny, I think as you are pointing out, you know, we need to follow the data. And what we know when we look at other countries, particularly in Europe, like France and like Germany, like Italy, we know that they're having a significant problem with the spread of COVID-19 that is mostly due to the United Kingdom variant. We also know that countries like Israel and the United Kingdom that have effectively vaccinated their population tend to see less problems, even with the United Kingdom variant. Although England, the United Kingdom went through quite a time before they got more of their population vaccinated, which was part of their choice to do first doses and then delay second doses. Israel made a deal with Pfizer and has now immunized about 2/3 of its country's population with one dose. UK, about half of their country's population with one dose. We remember back in the summer when Florida was being very aggressive and everything looked pretty good in Florida for a while, and then things sort of took off. So, you know, Texas is reporting a decline in hospitalizations. We know that Texas is opening up. I think that the first Major League Baseball park to have full attendance and no masks is going to be the Texas Rangers Stadium. So it's going to be important for us to watch Texas as things go forward. And right now they have also not been, at least by their own evaluation, have been hit by as many of the UK variants as perhaps some other states have been. Among the states that have the highest county rates in the country include some counties in Virginia and some counties in Pennsylvania. So we know in our border states that we're seeing more COVID-19 from the United Kingdom variant as well. And I just reported that although ours are still much lower, I think Michigan has 1,200 or so cases of the UK variant, and we have just over 100 right now. But we also see that spreading and increasing in West Virginia. So I would just say that you know, in Texas, many cities have continued to try to enforce some masking mandates. I know Austin had activity around that, but we'll watch Texas closely because, as you point out, they appear to be an outlier right now from what we at least would expect. And so it's always important for us to gather data from each place so that we can look. But of course, we want to very conservatively and aggressively approach West Virginia, because although it's great that Texas so far has not seen a steep upswing, we have seen an increase in cases over the last few weeks. And we've also seen an increase in the United Kingdom variant in West Virginia. And we know that our cases are in younger people mostly. So, and this is a group of people that we haven't focused on our vaccination efforts, which we're doing today. So we'll watch and see, but we still maintain our focus on the safety and the health of the citizens of West Virginia. Thank you.
All right, thank you, Kenny. Next to...
So come back to me just one sec. You know, Kenny, now I'm not a doctor. And you know, all through this whole thing, you know, we have been led by medical experts, and we've been led by common sense, and we watch and everything else. I would say this to you, you know, my sister lives in Texas, and you know, from the standpoint, you know, the weather in Texas is hot and dry for the most part and everything. I always wonder, you know, how as we entered the season last year in the summer, where the sunlight and the weather was much more warm and everything than the wintertime, we thought we were seeing an effect on the weather on this terrible killer. But nevertheless, Kenny, you bring up a good point, and all of us need to watch closely and everything. It would be hard to imagine that we would come to a situation where we believe that these masks were part of the problem rather than part of the solution. I mean, just look at the flu. You know, the amount of flu that we experienced this year. So I do not believe in my heart that the masks are part of the problem and rather than part of the solution. However, let's just absolutely not, you know, jump any way too fast, and let's keep watching everybody. You know, if we can learn from somebody else and everything and move forward and everything, more power to us. I'm telling you, I'd love to get rid of the mask, and I know Dr. Marsh and everybody else would too. So we're going to watch, okay?
All right, next we'll go to Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams of Ogden Newspapers. This question's probably more for the health experts, but I'm kind of trying to gauge how well we're doing at this point with vaccinations compared to other states. Obviously, we were leading in the beginning. That much is for certain, but looking at some of the data I'm looking at, CDC, New York Times COVID tracker, it looks like we're still doing great, but we're still more or less in the middle of the pack as far as states go. I think New York Times had us around ranked 31 for doses, partial doses in arms. So I'm just trying to get a handle at where we're at, and if we're starting to run into that hesitancy. Obviously, you guys are pushing now for 16 to 29-year-olds to get vaccinated due to the variant. Are we seeing some hesitancy in that age group, not just because they don't want to take it or have fear of taking it, but because, you know, they're young and indestructible? And are we starting to see, since we had older people get involved with the vaccinations early on, are we starting to see some hesitancy in the remaining age population? Thank you.
I'm going to defer to General Hoyer, but before I do, let me just say this, Stephen. You know, you're pointing out the very point that I was probably the most concerned with. You know, we were just knocking it out of the park, and I absolutely, you know, the one thing we don't want to do is get in a situation where we've got vaccines that are sitting around and we're trying to find an arm to get them in. But you know, there's no question that kids think they're invincible, and you know, so from all that, you know, you have that hesitancy. But you know, General Hoyer, maybe you could add a lot to it. But we want to continue to get all the shots that come into us in somebody's arm.
Yes, sir, Governor. And Stephen, I think there's a couple things to look at, and I mentioned earlier we're working with CDC on refining data this week. So we still execute 100% of the doses that we receive centrally to the state of West Virginia. in arms each week. That's the governor's mandate to us. It becomes a little bit more challenging on managing second doses at 100% because of the time lags within which you put those in arms, but we still get those done in the appropriate time. What you see in some of the trackers, New York Times and others, relates to total doses that come in to the state. So under other federal programs, such as VA, Bureau of Prisons, some of the other entities that receive doses, those numbers are reflected in those numbers that you just described. The other thing that the governor has us focused on is the targeted populations. So we know in West Virginia that over age 65, we are probably rapidly approaching 75% of the population over age 65. We also look at total number of West Virginians eligible. So that's where you start to see those differences from those national trackers. But again, our primary metrics are to focus on 100% shots that we receive centrally go in arms each week, and then to stay focused on those targeted populations, which, as you pointed out, are now starting to shift to younger populations as well. Thank you.
All right, thank you, Stephen. Next to Mark Curtis with Nexstar Media.
Good morning, Governor, and good morning, cabinet members and fellow members of the press. I've got to take a hard left turn here because it's an important story. Governor, I know you've moved your summit with the House and Senate leaders from noon until 4 o'clock this afternoon. Without placing your cards on the table, I'm wondering where the flexibility is, where the areas of compromise might be on these vastly different three proposals. I mean, you in the Senate have proposed sales tax increases between 7.9 and 8.5%. The House has no sales tax increase. You in the Senate want to phase out the income tax in about 4 years. The House wants to go 12 years. Given those differences, is there enough time to get anything done by the end of the legislative session or looking at the special session? But again, really, where are the areas you might be flexible and willing to compromise and come to some agreement with the other two parties in this negotiation?
Well, Mark, I'm not going to get into a lot of it right now because I don't want us to start vetting, what I'm going to say and what I'm going to propose, when we meet. I just know just this, and this will be, just halfway parameters from my end, but I know without any question that this is the biggest opportunity that West Virginia has ever had in its history. Ever. And absolutely, I know that the general public, for the most part, still doesn't understand all the possible or all the assets and maybe even doesn't understand some of the liabilities. Now, from all of that, it is all of our responsibilities, whether you be a House member, you be a Senate member, you be the governor's staff, it is all of our responsibilities on something that is this big to make sure that all of us have the knowledge and understand. Now, Mark, I am yet to talk to one person. I am yet to talk to one person that when they really get it all, I don't know one person that isn't saying, well, we got to do this. We have to. I mean, this is the greatest thing in the world. Because at the end of the day, what we got to do is we got to come, Mark, and I got to mention this, when we all got together, and I had repeated meetings over and over and over with, leadership. And when we all got together, the whole concept was, it doesn't matter, Governor, if you want to run it as your bill, we'll run it as our bills, and so not from the standpoint of a different plan, from the standpoint of the plan that I was putting together and crafting with all the leadership and the people, so the long and the short of this whole thing is just this. The most important thing that this state has ever had put on their plate, and you're right, Mark, we're running out of time. We're running out of time. That's all there is to it. The most important thing of all that the state has ever had put on their plate And really and truly, we don't need to run out of time without really trying. And that's what I'm trying to do. I'm trying to put forth a plan that does these things. It does not hurt one group to the benefit of another group. It does not lay the burden on those that are struggling and having the worst time. That's one thing. Second thing is, absolutely, without any question, I am not for any level of food tax, because I think that really, really hurts our people that are really having a tough way to go. Now, beyond that, Mark, I have said I am just about open to anything and everything, period. You know, there is so much space in what I want to do and what I'm willing to compromise on. It is limitless. But you know, Mark, I've got to have input. I've got to have input back on what the other side would like to do. Now, you know, like it or not like it, but the Senate bill is struggling to even get out of committee. So the Senate bill is probably having a really tough go. The House bill, like it or not like it, but it's just true, it is strung out so long that at the end of the day, I don't think, nor do I think, you know, that most people think that we'll ever get it done. So I really believe, you know, that's about all I can say right now. I really believe that I am super flexible. And really what I want is just one thing. I want every breathing West Virginian to have more money in their pocket, period, with this plan, after they pay any increase in any taxes, than they do today. Significantly more money in their pocket. Every breathing West Virginian. And I don't know how on this planet any of us could have opposition to that. And in addition to that, what I want is I want to stimulate and grow our businesses. And absolutely this will do that so simply because we put money into the system like you can't imagine, money back in our people's hands. They decide what they want to do with their money and how to spend their money. And absolutely, as I've said it so many times, the dress store downtown, which is the typical small business, thrives over and over and over because of the money, the additional money that's out there in the system. And at the end of the day, anybody on the planet is going to have to say, there's going to be people move here. That's all there is to it. Population will not continue to go down. People will move here. And as people move here, think what will happen. It'll help our schools. It'll help our roads. It absolutely will help in every way that you can possibly imagine. Bring more jobs, bring more opportunity, raise wages, raise your home value. I mean, absolutely, at the end of the day, the most important thing of all, the most important thing that we could possibly be here to do, you know, and I know it. It doesn't mean it's no skin off my nose in any way. In fact, everything I have proposed, which is just the opposite of some people that have reported in newspapers and said, oh, Justice is trying to do something to help justice. Are you kidding me? Are you totally kidding me? What I have proposed over and over and over from just the standpoint of our mining operations would cost justice millions. But justice is willing to step up. That's all there is to it. So, Mark, we'll see. We'll see. I hope and pray that everybody will come with an open mind and we'll put everything out there on the table and you know, and I hope everybody will come and watch because, you know, it is, you know, from an economic standpoint, it is a monstrously important time. And we don't need to blow it. We need to all work together, and that's what I'm trying to do. Whether it be the House or the Senate, or it be the majority or the minority, we need to all work together. We can do that. We can do that. I'm surely willing. In fact, I am absolutely wanting to be an open book and compromise in any and every way I can. you know, my problem right now is the only person I'm really negotiating with is the public. And I do it over and over and over. And how I do it is just simply just this. I have the town halls and the public speaks and I listen and I negotiate with the public. But in this situation here, which is so important, I mean, it's just off the chart important, we need to be negotiating with the governor's office, the House, the Senate, and we need to all come out with something that's great for everybody. Sorry for the long answer.
All right, thank you, Mark. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was hoping to get an update on the plans for vaccinating our, our corrections population. I know we said at the end of last week that we were moving toward that. I wondered, where are we at with those plans? Do we have an idea of when that effort will get underway? And do we know how long it'll take? Thank you.
General Hoyer, please answer it.
Yes, sir, Governor. Charles, the vaccination process with corrections is already underway. My understanding is as of last week, we had vaccinated 975 in certain age categories. We'll continue to focus like with general population over age 65, over age 50, and continue to work through key priorities that corrections has, like vaccination of those in regional jails who are being moved to long-term residency in the prison system. So that effort is in fact underway and moving forward under the direction of corrections, with doses being provided by the Interagency Task Force.
All right, thank you, Charles. Next to Brendan Tierney with WSAZ.
Good morning, Brendan Tierney with WSAZ News Channel 3 here. I have a similar question to Mark. Governor, I was hoping you could talk about the conversations you had over the weekend with leaders in the legislature and if they have committed to attending and who has committed to attending the meeting and where you think they are willing to find some sort of compromise on the income tax proposal.
Well, Brendan, I surely hope and pray they'll at least show up. I mean, for crying out loud, I can't imagine that a governor is asking our House and Senate to come and talk and see if there's a way that we can compromise and get some plan across the finish line. I absolutely believe they'll come, and from the standpoint of discussions over the weekend, I have not had any direct discussions with the leadership over the weekend and everything, because Easter weekend, they've been working really hard down here and they went to their homes, and I worked an awful lot on my stuff over the weekend with my people, but as far as having conversations with the leadership over the weekend, I did not have any. We moved the time to facilitate and accommodate, and so our meeting today is what we ought to be doing. It's exactly what we ought to be doing. We ought to be sitting together and trying to work something out that's really, really good for the state of West Virginia, and so that's what I hope and pray we'll be able to do.
All right, thank you, Brendan. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel, fellow journalists. I get to follow two states in my beat on this coronavirus, and Maryland is one of them. And one of the new advisors in Maryland is the former CDC director, Robert Redfield, who came out and said that he thought that it was maybe more likely that the virus originated in a Chinese laboratory than going from a bat to a human. And he's gotten some blowback on that. I'm not going to ask why or if you support it, but I do want to know how much the politics of all this plays into how you look at studies. Obviously, there are different opinions out there, and a lot of them are politically influenced. And I'd like to know if Dr. Marsh and Dr. Amjad pay attention to the noise out there and how difficult it is not to pay attention to the noise when reviewing the studies out there. Thank you.
Well, Paul, before they speak, I would just tell you this, that you know, you see what's going on in Washington, and in many ways you see the Charleston swamp as well. You know, where we have grown to politically in this country could very well become our demise. You know, but it is really hard. It is hard to extrapolate, you know, from you know, as to what's what a lot of times, because you're getting people, especially in DC, but you're getting people to stand up and say anything. And knowingly, it's nothing to, it doesn't even approach anything close to the truth, but yet they do it. And they do it over and over and over. They exaggerate. They absolutely think that they can say anything they want to say, and it's just, well, that's politics. Man, my goodness, there's no place for that in my life. None. If you knowingly are telling something that you know is not true, then it's a lie. It's not politics. And so, Dr. Marsh, maybe you can answer, or Dr. Amjad, you know, but what we need to first and foremost do is listen to the experts. We have medical experts and we have doctors in our society for a reason, because when we get sick, we go to the doctor, you know, and so anyway, y'all answer, please.
So maybe I'll start off and then I'll turn it over to you. So thank you for the question, Paul. I think that's a very important one. What we try to do is understanding that there's not only outside influences that may impact, you know, what people are saying on, at least on news bites, et cetera, but that this pandemic is unfolding still very rapidly, and we are constantly learning about this very novel virus. So I think that there are two issues. Number one is that there is the clear, you know, effect of people having motivations that may be more personally directed or politically directed to have certain views. But also, this is a very dynamic event that is, again, once in a lifetime that we're seeing unfold. So the best thing, at least in my opinion, is to not just look at single pieces of data from single people, but start to look at what is the compendium of information that comes out that is more validated by multiple sources, looking particularly at certain experts who tend to be less motivated by, you know, external events and more focused on the virus and what the virus is doing. And there's plenty of public servants that do that very well. But for us in West Virginia, the other thing that's so important, Paul, that I think the governor has done a really tremendous job of, is that, you know, we speak the truth. We tell you on these broadcasts, we tell the governor absolutely what we think. There's no impact of, you know, of politics or him telling us to say certain things or not. And we tend with our leadership group to be very focused at being very active, trying things that we believe will help, and then measuring the outcome, whether that's looking at vaccination of our nursing home population and not starting the federal pharmacy program, or whether it's getting our kids back in school, or it's looking at our map that we created for the first part of 2020 for the school year that we stopped doing in 2021. And of course, these are all the governor's decisions. But the great thing about West Virginia, which I think is one of the reasons why we've done well, is because we've had a clear directive: save lives and reduce hospitalizations, maintain our community services. And we've also had a lot of discipline and great leaders at these different levels, whether it's General Hoyer and Colonel Peel at the JIADA, for Secretary Crouch and Dr. Amjad at DHHR, along with many, many others that are doing such an extraordinary job for West Virginia. Ein, I don't know if you have any other comments.
The only thing to add in addition to what Clay said is that we learn from other countries and other states, and that we're very observant, and that we use good West Virginia common sense. You know, we read a lot. We read sound medical journals. We read things that maybe are not medically sound, and we use our judgment. So I think when you put all those things together, we can apply that to what we've done here in West Virginia, and I think we've made some good decisions with that. So I think you learn everything that you can, but you also have to use some good common sense and see what's in front of you. But that's all I'll add to that, Paul. Thanks.
Great, thank you, Paul. Next to Mark Cram with WDVM.
Well, good morning to everyone, and just wanted to comment on the work that's being done up here with the staff and volunteers. At least what I've seen in the Eastern Panhandle, I've seen for myself the tireless efforts and great work that's being done in getting these vaccines distributed. This morning we received a news release from WVU Medicine that a drive-through clinic will be established next week in Charlestown at the Hollywood Casino, with a phenomenal 10,000 shots per week being delivered. Have no doubt the staff can deliver that. I guess the question is whether individuals will sign up and show up. How many weeks do you anticipate holding this large-scale drive-through clinic? And will you be doing something similar in other portions of the state? Thank you so much.
Mark, this is Jim, Mark, but I want to thank you. You have been terrific. That's all there is to it. You've done great work, and your reporting and your bulletins and all the stuff that you do for the public has been great. I really want to just take a second to thank you, you know, and as well as all the media that show up all the time and you know, ask questions and everything. You know, I really, you know, at the end of the day, this has been an effort, you know, from the standpoint of right from the get-go, that West Virginia could have absolutely hemorrhaged in every way. And whether it be all the experts or the guard or all the people that are on the ground, you know, whether it be the health departments and on and on and on, you know, you know, we've also got to really take time to thank all those that are in the media that helped us get the words out so people would show up to get vaccinated. And you know, so I've asked you many times to continue to do that. Mark, you asked a question, led me to the thanks to everybody on the calls that are always on the calls. And General, if you could answer the question about what's going on in Charlestown, and you know, please do so.
Yes, sir, Governor. Mark, as you pointed out, starting next week, working with the local health department and many others, the health clinics, WVU Medicine, this was an effort that the governor tasked us to increase capacity in the Eastern Panhandle, which we had concerns about. There are clinics, larger clinics that go on regularly in Kanawha County, in Monongalia County. We're also working with WVU Medicine on Wheeling and the Northern Panhandle. You have efforts that go on with Mountain Health in Cabell County on a regular basis. So we will continue this as long as we need to have that increased capacity. It also includes more doses going to pharmacies in the area and pharmacies participating in this larger scale event. But again, designed to penetrate into as many of the population as we can that will take the vaccine and get those numbers where we need them to be across the state of West Virginia.
All right, thank you, Mark. Next to Ryan Quinn with the Charleston Gazette-Mail.
Hello, Governor. I checked this morning on the Department of Education's Outbreaks website, and just counting active cases from school outbreaks alone, we've got about 420 as of today. And do you really think that this is just the impact of this new variant, the UK variant, or are schools slacking on their mitigation measures? Is it still true? I know Dr. Marsh has mentioned this in the past, that there's not been any in-school spread beyond extracurriculars. Are you actually starting to see in-school spread beyond extracurriculars now? And are you planning to do anything to order any schools or grades to close again, considering how high active cases have gotten in schools?
Well, Charles, I'm going to defer. I'm sorry, Ryan. I'm going to defer to Dr. Amjad and Dr. Marsh, but I will try to address the tail end of your question, and that is, well, I'll try to address a little bit on the front end too. I've been in schools a whole bunch here recently, and really I see them doing absolutely good work. I see the kids the kids have just adopted just wearing their mask and everything, and really I see people going around gymnasiums and everything and spraying down after people leave and doing all kinds of stuff like that. Now I do see that a hesitancy in kids taking their vaccines and that's just because kids think they're invincible and they don't have the knowledge yet, and that's why we've got to educate and help them understand, but we made a real concerted effort, to get all of our teachers, all the service personnel and everything vaccinated. And then the tail end of your question, if I remember correctly, you said, something along the lines of, do I see us with the possibility of closing schools or whatever because of an issue that may jump out at us? And at the end of the day, Ryan, I would just tell you just this. We would be foolish, and that's a kind word, foolish, to say anything is set in stone. We need to always be able to pivot and tweak and be fluid and move. And really and truly, our outside activities that, the extracurricular stuff and everything at school, we need to watch that all the time. But the bottom line, Ryan, is just this. If we got a problem, we're going to run to the fire. If the problem is bad enough that we think really and true we need to close the school, we're going to close the school. That's just all there is to it. That's just smart money. That's what you do. But at the end of the day, what we got to do is we got to continue to message to all of our kids and all those that are in our school systems that just this, and this is all there is to it. This thing's not over. This thing's not over. Just because the sun's shining at 70 degrees and the tulips are all blooming, this thing's not over. And so we just got to stay on guard and get through the finish line. And the other thing is naturally, we got to be in school. We know the devastation by not being in school. And so we got to be in school. So we're watching it every day. So maybe Dr. Amjad and Dr. Marsh, take over and add anything that I missed.
I'll start. So Ryan, we actually have 53 active school outbreaks right now. And to answer some of your question, the majority of the outbreaks that we have right now, we're seeing them actually in sports teams. So we have not seen many school outbreaks that are in the classroom right now, and that is because of the mitigation efforts with students wearing masks and also the teachers. And a lot of the school personnel have been vaccinated, which is a good sign. So the Department of Education, along with the school staff, a lot have been vaccinated, which is good. So we do see that vaccinations do help with COVID-19, which is also why we've been encouraging that. And also because students or young adults 16 and older can get the Pfizer vaccine, which is also, we've been pushing that. We've had a lot of schools signing up to do what we want for calling family vaccination clinics to get 16 and older and their families to get vaccinated. And also with that, it can also help with the sports teams and those types of events that we're seeing this transmission in the highest in our school settings right now. But if the school spreads inside the classroom, we are not seeing a lot of that because of those efforts that we are, talking about inside the classroom actually. But right now we actually have 53. I think on the Department of Education, what you might be seeing, a lot of the schools are putting all of the ones out there, or there might not be clearing out the ones that have also already been closed out. But we actually have 53 right now throughout the state. But I don't know if you had any other questions. We can answer them afterwards, or if Clay has anything to add. But thanks.
No, the only thing I would add is, at least to my understanding, and I might have updated information, but to date, we have not seen active spread in the classroom with the appropriate mitigation measures. But we know that the United Kingdom variant is infecting more younger people, as well as other variants like the California variant, which we've also seen. So ultimately, we know spread is increasing in younger people. If we are very careful in the classroom, we still see it as being very safe. And as the governor said, very important to not lose a generation of our students to not being educated, as a four-year college degree seems to be able to insulate, protect people from these deaths of despair and hopelessness. And we know that in the setting of loss of that education, it can cost people life years. So it's really important, not just for the economic future of our state and our citizens, but it's also important for the health of our state and our citizens that we continue to do this to the absolute maximum level possible, keeping kids in school. Thank you.
All right, thanks, Ryan. Governor, I'll turn it back to you.
Well, I really don't have anything else. I thank all the medical experts, all the people that are out in the field, and the health departments, and the clinics, and communities, and all the people that are first responders, and the National Guard. Good gracious, the job they've done is unbelievable. But thanks again to everybody, and I'd end by saying this kind of gets away a little bit from the COVID thing, but it is enormously important. I've said over and over and over, my job is to look after the health and safety of West Virginians. I hope and pray you think I've done exactly that. My next part of my job is to always mind the store and look after the economics of our state. And absolutely, I hope and pray that you think I've done that. Now, one of the things that is part of my job is to lead us to where we need to go. And without any question today, if you'll watch at 4 o'clock and everything, and watch our summit on getting rid of our state income tax, it is an enormous move. It takes some guts. And absolutely, at the end of the day, it will be the very best thing for all of our people. The very best thing for all of our people. It will put more money in all of our people's pocket, and it will stimulate our businesses beyond belief, and it will give us a chance to grow. I mean, we've proven how to fail. We got it down pat. We know how to lose the games. It's time to win the game. And so I really challenge you, please, if you got time or you can record it, it'll be live streamed at 4 o'clock and everything. Hopefully we'll come up with some great ideas. I am as absolutely flexible as a human being can be. All I'm wanting us to do is not put a burden on anybody in order to benefit somebody else. And so with all of that, and the other thing is I'm very, very hopeful that our people from our coal industry or gas industry or soda pops or whatever it may be are willing to step up just a little bit and help us, because all of us need to be in this boat together. I mean, any of those companies, this is going to be an instant pay raise for all of your employees as well as yourself. It's going to be an instant pay raise. It's not going to cost the owner a dime. Now, with all of that, the other thing that we've done is we've invited all the legislatures. Every single one of the legislatures has been invited, and we welcome them to come, and we'll social distance them in the audience. We can't have the public because that's too many people. It's just too many people, and we can't do our social distancing there. But we can do it, in a cultural center, theater and everything with our legislatures. We welcome them. We hope and pray that they'll come, and that good will come out of it. Really good will come out of it. So with all that being said, tune in at 4 o'clock, and it is an opportunity that I know in my heart without doubt, we just can't miss it. If we do, we do. And then, but you can't say that I haven't tried. And you can't say that I think it'd be really tough for anyone to say that I've led you somewhere on a wrong path. I'm not going to do that if I can help it in any way. I know beyond all doubt that this is what we should do. So we'll try again. And I hope everybody will come with an open mind. And whether you be a Democrat or Republican and everything, I hope we'll come first and foremost being West Virginians. Anyway, thank y'all so much. God bless. Way to go, West Virginia. You've done amazing work. Keep it up. Appreciate you more than you'll ever know.